If you are struggling with anxiety and you're using medication to get relief, but you experience side effects from those medications, well, 2 recent studies have suggested remarkable benefits of mindfulness meditation to significantly reduce anxiety symptoms. And today, I'm going to break down the key findings and recommendations from these 2 studies. And I've divided this video into 2 sections. In the first section, I'm going to explain the key findings from the 2 studies. And in the second section, I'm going to share some very practical steps that you can take if you want to use meditation to help reduce your anxiety. Let's start by discussing the first study. It involved 93 participants who were divided into 3 groups. One received mindfulness meditation training. The second received an anti-anxiety medication that's very common called escitalopram. And the third group received a placebo pill, which is just a sugar pill. Now, surprisingly, both the meditation and the medication group showed significant reduction in their anxiety symptoms when they compared them to the placebo group. And there was no significant difference in the overall improvement between the meditation and the medication groups. But here's the intriguing part. The meditation group had a higher rate of symptom remission compared to the medication group, meaning the symptoms stayed away. And in fact, 31% of the meditation group experienced complete symptom remission, whereas only 22% of the medication group achieved the same result. Now let's go on to the second study, which was even a larger and arguably a better study. It compared mindfulness-based stress reduction with meditation with the same common anti-anxiety medication, escitalopram. The findings were astonishingly similar. Once again, there was no difference between the 2 approaches in terms of effectiveness in treating anxiety. Now, these findings suggest that mindfulness meditation can be a valuable addition to your treatment options. It offers a natural, non-invasive alternative to medication, which can be particularly appealing if you prefer non-medical approaches or if you're already experiencing unwanted side effects from the medication. Let's go on to section 2. What are some practical steps for you to reduce anxiety if you're interested in giving mindfulness meditation a try? Well, here's some recommendations to get you started. Number 1, find a qualified instructor. Somebody who's experienced and certified in teaching mindfulness meditation. Or if online is really your thing, you can also explore a number of meditation apps like Headspace if you prefer that approach. Number 2, start small. Gradually increase the duration of your meditation sessions over time. Don't expect to sit for an hour on your first try. Begin with just a few minutes and build from there. Number 3, be patient with yourself. Be kind. Mindfulness meditation is a practice that requires time and dedication. Don't expect instant results, but stick with it. Over time, you are very likely to begin to notice improvements in your anxiety symptoms. Number 4, make meditation a consistent part of your routine, like brushing your teeth. Set aside dedicated time each day to engage in the practice. Even if it's just a few minutes, consistency is the key. And number 5, approach meditation with an open mind and a willingness to learn. It can feel challenging at first, especially if you're new to the practice. Embrace the process, and you will likely be surprised by the benefits you experience. Now, in conclusion, the recent studies on mindfulness meditation and its potential as an alternative treatment for anxiety are really promising. It might not be the right approach for everyone, but it's definitely worth exploring, especially if you're seeking natural, non-invasive alternatives to medication. I hope the information provided in both of these sections empowers you to take control of your anxiety and live a calmer, more peaceful life. And if you drink coffee, then I'd recommend checking out this video where I explain 10 effects of caffeine on your body.